Hi everyone, this is GK. Welcome to GK's Golden Knowledge Show on Business and Finance. In business and finance, we often talk about managing risk and planning for the future. But just like in the financial world, managing your health is also about being proactive and informed, especially when it comes to long-term well-being. In this very special episode today, we have with us a wonderful guest, and he is Dr. Terence Lim. Dr. Lim, welcome to the show.
Hello, everybody. Hi.
Dr. Lim, can you share with us what do you do?
Okay, I'm a urologist. A urologist is a kind of a medical specialist that specializes in the urinary tract.
Okay. So how long have you been doing this awesome work?
I graduated back in 2003, so about 21 years actually.
Wow, that's more than 2 decades. And
Yes.
what got you into this field?
Okay, I guess the main thing about urology is it is a special mixture in terms of medicine as well as surgery, because there are many urological conditions that can be treated with just medications alone, but there are also conditions where we can treat with surgery. So it allows me to have sort of like best of both worlds.
Okay. So it's surgery plus medication, right?
Yes.
Okay. Since you are a urologist, right, can you share with us what are the most common urological conditions that you see in your last 21 years of practice?
Okay, so in theory, the field of urology involves organs where the urine or the sperm flows through. So anything where the urine and the sperm flow through, it belongs to urology. So the most common urological conditions that I see are like kidney stones, urinary
Okay.
tract infection, enlarged prostates, or cancers of the urinary system like kidney, bladder, or prostate cancer, or even testicular cancers.
Wow. All this seems like they are men-related conditions, is it? Or does it apply to women also?
Well, you are right to say that a lot of urological conditions involve mainly men, but I do have a fair proportion of patients who are female, especially when they have urinary tract infections,
Mhm.
and a lot of urological conditions like kidney stones, cancers of the urinary tracts are actually not gender biased.
Okay. Got it. So can you explain the symptoms and causes of kidney stones and how they are treated?
Okay, the symptoms of kidney stones are actually dependent on the position of the stone. So in general, stones in the kidney usually have no symptoms, but if they are causing obstruction, then they can cause pain in the upper back.
Mhm.
Stones in the upper part of the urinary tract, this is what we call a ureter. This is a tube that connects the kidney to the bladder where the urine flows down. Will typically cause pain radiating from the back to the front of the abdomen and sometimes even radiating down to the groin.
Okay.
Okay, and stones in the lower part of the ureter can also present with urinary symptoms like urinary frequency, urgency, and sensation of incomplete voiding. So the main cause of urinary stones are generally inadequate water intake, especially in this part of the world where the temperature is hot. Some food may be associated with higher risk of stone formations, and this includes black tea, instant coffee, peanuts, excessive vitamin C and D, and those dark greenish vegetables like spinach.
Oh,
And lastly, with regards to treatment options for kidney stones, I often tell my patient that treating kidney stone is like buying a property. There are two things that we need to consider. The first is the size, and the second is the location of the stone.
oh my God.
And the treatment options will actually include shockwave therapy,
Mhm.
laser therapy with scopes, or minimally invasive options, which will be actually tailored to the patient's stone in terms of their size and location.
Okay, I see. Very interesting. In fact, I think more than 10 years ago, I had this condition of kidney stones,
Mhm.
coming down my, you call it urethra, right?
Yes, correct.
And the pain was so excruciating. And later on, I realized this pain is worse than, women giving birth.
Yeah, well, you're right to say I have female patients to tell me that actually this kind of stone pain is
Mm.
as bad as labor pain. Although they didn't say it's worse than labor, okay,
Okay.
but in theory, it is like you're giving birth to a stone instead of a baby.
Yeah. Wow, it was really a horrible experience for me back then. Yeah.
Yes.
And then from there, from then on, actually, I was very careful, not to have it again. Yeah.
Yes.
So, can you share with us also how does prostate health change as men age, and what should men like us be aware of?
Okay, so in general, the prostate gland tends to enlarge as men ages lah. So in fact, about 50% of men above the age of 50 will have an enlarged prostate, and at 80 years old, almost every man will have an enlarged prostate lah. Okay, although not all will show symptoms. So as man ages, so their prostate can actually cause several issues, including urinary problems like poor urine flow, sensation of incomplete voiding, or waking up at night to pass urine. In addition, the incidence of prostate cancer also increases in age. In fact, at this point in time, prostate cancer is currently the most common kind of cancer among men in Singapore.
Okay. So when you say it's common for men, is it like the top or number two or number three?
Prostate cancer has overtaken lung and colorectal cancer to be the number one cancer among men in Singapore.
Oh my God.
Yes.
Okay. Wow. So it's very important for us to really learn more about this from you into this session.
Yes.
So what will be some important health screening that men should consider as we age?
Okay, I guess besides the usual health screening like taking your blood pressure, checking for diabetes and high cholesterol, I think men and a lot of health screening actually provides a screening for various cancer of the body lah. Okay, like colorectal cancer and prostate cancer. So in terms of tests for urological health, men can consider in consultation with their urologist doing tests to assess their kidney function, checking for blood in their urine, and assessing for their risk of prostate cancer. The easiest way to do will be a testing of their blood for this antigen called the PSA or prostate specific antigen.
PSA.
PSA. P.
PSA. Okay. And how often should all this health screening be done?
Okay, in general, there is no guidelines to say how often anyone should do their health screening lah, because it depends on what kind of thing they're screening for. But in general, for prostate cancer, although we cannot recommend routine health screening, but in general, it would greatly depends on how old you are and what are your previous PSA reading. So it can be as repeating PSA testing can be as short as 3 months if there's a high risk or suspicion, or once every few years if the risks are low. So it is based on the individual risk factor, which is why, as I mentioned earlier on, that if men wants to consider screening for prostate cancer, it should be done in consultation with their urologist because there's no hard and fast rule.
I see. Wow. So as you mentioned, prostate cancer is like now the number one killer for men, right? And this is going to be a significant concern for men. So what are the early signs and how is it typically diagnosed?
Okay, unfortunately, early prostate cancer often has no symptoms. Urinary symptoms like those I mentioned earlier, like poor flow, needing to go to the toilet more often, sensation of incomplete voiding, all these are common and are actually not specific for prostate cancer. They more often arise due to a benign enlargement of the prostate. So unfortunately, the most common way where prostate cancer is diagnosed in Singapore now is from an abnormal PSA blood test. So an elevated PSA level will usually prompt further evaluation to rule out prostate cancer, generally in terms of doing an MRI of the prostate and KIV a biopsy.
I see.
Yeah,
Okay.
and then generally by the time symptoms appear, most of the time prostate cancer will be rather advanced because prostate cancer generally arises from the periphery of the prostate rather than around the area where urine flows through. So the prostate cancer needs to be of a significant size in order for it to cause urinary symptoms.
Okay. Okay. And you mentioned that this will, start for men from age 50 onwards, right? And then at 80, it will be even worse.
Yes, generally the risk of prostate cancer increases with age. Yeah, so the older you are, the more likely that you will get prostate cancer lah. I think the lifetime risk of prostate cancer in Singapore is about 1:10 or 11 men. So every one man out of 10 or 11 will in their lifetime have prostate cancer.
Wow. That is considered like quite high, right? I think
Yes,
9 to 10%.
yes.
Okay. So what advancements have been made in the treatment of prostate cancer in recent years?
Well, actually, tremendous advances have been made in the
Okay.
treatment of prostate cancer, in fact, for all stages.
Mm-mm.
For localized prostate cancer, treatment options can include active surveillance, which means just watching the disease, because not all prostate cancer requires treatment, especially the low-risk ones. But those that require treatment can benefit from minimally invasive surgery to remove the whole of prostate, radiation therapy, or sometimes in selected cases, ablative therapy. In fact, major advances have been made in all these treatment options. Take, for example, surgery. Currently in Singapore, I would say the vast majority of surgery is now performed with the assistance of the robot platform. And this has been associated with reduced blood loss, lower complications rate, better operative outcomes, as well as a shorter length of hospital stay. Then, with regards to advanced prostate cancer, we now have many new options to help slow down the progression of prostate cancer and to prolong survival. So we have new second line, third line, or even fourth line medications or chemotherapy agents that can help in patients with prostate cancer.
I see. So with all this advancement in treatment of prostate cancer, right? Would you be able to share with us, like, what is the increase in percentage in terms of percentage, right? The success rate of recovering from the cancer.
Well, I guess if you look at localized prostate cancer, which means that the cancer which has not spread to other parts of the body, there are multiple studies that have shown that if you have undergone surgery to remove localized prostate cancer, your overall survival at the end of 15 years, or rather your cancer-specific survival at the end of 15 years approaches 90 to 95%. So that is actually very, very high.
Okay,
Yes.
okay. So although the chance of men getting prostate cancer is high, almost 10%, and is top killer, but with all this advancement in treatment, the chance of recovery is almost 100%. Can I say that?
Yes, yes. So I guess like all cancers, the early detection makes a difference. The early you detect a cancer, the more likely we are able to cure them.
Wow, that's very important. So thank you, Dr. Lim, for sharing your insights on common urological conditions like kidney stones and prostate health. I believe your expertise and years of experience, 21 years, right, have highlighted the importance of early screenings and staying informed, especially as men like us age. From understanding the signs of prostate cancer to learning about the latest advancements to the treatment, I believe this conversation has shown how proactive care can make a significant difference. So to all our viewers, remember that health, like finance, is an important investment. Stay informed and take action early to protect it. Once again, thank you, Dr. Lim, and I wish you all the very best in your practice.
Okay, thank you, everybody.
Bye-bye.
Bye bye.